We know that disease occurs. Some of our groups are better at detecting it than others. In human medicine, we have specific ways of identifying it, and we have reportable conditions. In companion animal medicine, we haven't quite got to that point yet, and so it involves really practitioners, practices, and taking a more active role in educating ourselves and educating our community. And there's a couple ways that we can do that. The first is to really know what's happening around you, and so there have been a couple of initiatives to better understand these. These are things like Worms and Germs group. This is also a group called CAPC. These two groups allow us to go into those databases and to see what types of diseases are being reported in your area, or maybe in a new area where a client is planning on moving or taking their animal for a visit. Secondarily, not only understanding the diseases around you, but also understanding the diseases within your clinic are really key. So these what we call hospital-associated or clinic-associated infections. So those infections which an animal is potentially getting and acquiring at your clinic are really, really important to understand and ideally to prevent. And the only way that we're going to be able to do that effectively is to start a surveillance program in our clinic. So this involves veterinarians as well as support staff identifying kind of the key risks for your clinic, then identifying ways that you're going to get some of these data. So for instance, if we're interested in surgical site infections, we can make sure that as we are calling back clients to find out how their animal is done over surgery, that we identify those individuals that are likely surgical infections. And then knowing which animals, overall which animals did have a surgery performed, we can then identify the rate or the proportion of animals that are having surgeries. Doing this allows us to better understand not only the risks for some of those animals when they acquire a disease, but also identifying outbreaks in our clinic. Using all of this information, we can more effectively target infection prevention and infection control practices so that we can make this a safer place for our pets, our animals, and for certainly our staff.